Merci.
Thank you.
My heart is with Sophie and the Prime Minister, and I wish them all the best in their recovery.
Should the leader of the government be tested for COVID-19? He's the head of the government. We're in time of crisis. He hasn't been tested.
Listen, obviously he's following public health advice, and that's what I would recommend every Canadian do. There are a number of situations out there, and public health will be the advice that we all need to follow.
Until Monday, April 20th, 2020 at 11 a.m. pursuant to Standing Orders 28.2 and 24.1.
Pursuant to an order adopted earlier today, the House is now deemed to be adjourned until April 20th, 2020 at 11 a.m. pursuant to Standing Order 24.1.
Well, Nathan, at this Loblaws at Yonge and St. Clair, some of the essentials like toilet paper, pasta and tuna are near to running out of stock or are currently out of stock. Grocery clerks in here waiting for a shipment to come later this afternoon to restock the shelves. And many shoppers we spoke with this morning said the images they're seeing circulating on social media of empty store shelves has them compelled to come out and stockpile. People lining up before this Metro in Scarborough opened, hoping to get a head start. But even those shoppers weren't checking everything off their list.
Is right now is to
but not unnecessarily evoking too much panic in our communities. We need to take lessons from what we've seen in Italy, what we've seen in other parts of the world that were very hard hit by this infection and weren't prepared, and containment strategies were probably taken a little too late. We don't want to be in that situation here in Canada, and I think erring on the side of extreme caution at this point in time is warranted and will probably save more lives.
And you are at Toronto Western, which is one of the designated hospitals in this country for this kind of coordinated screening. So how prepared are you? And give Canadians a sense of what the situation is so that we do not find ourselves in the situation that Italy is experiencing so tragically.
Yeah, so this is a situation we've been monitoring and preparing for very, very diligently and very constructively and thoughtfully since the virus and the outbreak, before it was even called a pandemic in Hubei province. We've been taking it very seriously. There have been innumerable meetings, there have been innumerable discussions and preparedness plans between different levels of care, particularly critical care within our hospital and other hospitals around Ontario, and we're still working on establishing a more firm and prepared provincial strategy to hopefully prevent things from becoming more problematic if and when the problem gets worse here in Ontario.
And we are seeing the problem worsen, certainly in the United States, and we're going to go to Richard Madden now, who is in Washington. And Richard, there's been so much controversy over the fact that these tests for COVID-19 have just not been ready. They've not been given enough. When you look at South Korea getting something like 10,000 tests a day and the U.S. only getting 1,100, has that situation improved?
Well, the president hopes that will asked to give more resources to the states. Trump has been criticized for downplaying the severity of this crisis, but after declaring a state to the nation a few days ago that was riddled with errors, the White House having to correct it, the president is hoping to give it another crack today when he does address the nation, and expected to declare that state of emergency to really get things going and get test kits into the marketplace.
Okay, interesting. We'll wait for that. That's at 3 o'clock this afternoon Eastern Time. You're looking at Rideau Hall, where it's not like the Prime Minister is in an undisclosed bunker, folks, so there's nothing to panic about here. He is in the beautiful Rideau Cottage at Rideau Hall, just across from 24 Sussex, actually. This is where the Prime Minister lives. Again, we will hear from him. He is expected to walk out of that building and his home and address the nation. And Doctor, some of the things, as you've been saying, there has been a lot of panic. And I think this is a really good time for people to sort of take a breath before what we understand may be much, much higher numbers. What is your best advice to people in just living their everyday lives? I mean, obviously this has gone sideways pretty quickly. So how do people maintain a normal life under such abnormal circumstances?
Yeah, that's an excellent question. And I think one of the upsides of all of these cancellations and closures of schools and whatnot is it gives us an opportunity to maybe simplify our lives. And it gives us an opportunity to be as basic and minimalist as we can be. And I think it also gives us an opportunity to really reflect on our own individual empowerment. What can we do rather than being focused on what we can't do and what's not available to us? Let's focus on what we can do, how we can remind ourselves that optimal hand hygiene is so critical.
It sounds so simple. It sounds so simple to say, wash your hands for 20 seconds with soap. Don't freak out if there's no Purell on the shelf. Use soap. But you're saying that still is the first line of defense.
It's still the first line of defense, and we know that many respiratory viruses and other viruses are acquired or transmitted through touching our face, our eyes, our mouth, and our nose with hands that are contaminated. We know that contaminated surfaces that are high contact, such as desks and tabletops and handrails.
Not the CTV newsroom, though. We have it all very
Absolutely.
clean. I'm going to go to Ottawa Bureau now, and Joyce, you're there. I want to understand a sense of what we've just heard from the Public Safety Minister, who just addressed reporters there on Parliament Hill.
Well, you know, and also the Prime Minister earlier this morning saying that the government is starting to warn against international travel and is considering to tighten the border, which is a question that was asked again and again to ministers yesterday after the United States decided to
Actually, Joyce, I understand that Christian Ireland is speaking right now, the Deputy Prime Minister. So let's listen into her before we hear from the wait, she's just finished that. This is how fast and rapid fire all of the news is unfolding right now. But we know that we're just moments away. Is in front of Rideau Hall, Rideau Cottage. Kevin, give us a sense of what we can expect from the Prime Minister.
Well, certainly, Lisa, I think there'll be something to reassure Canadians. This is a very stressful time for a lot of people. Of course, we've seen all the pictures of grocery stores with bare shelves, and now schools and universities being canceled in many different provinces, all across Quebec, of course. Now we're hearing so. The other thing, too, is that it's a very bizarre situation to have the leader of the government, the Prime Minister, really self-isolating, working from home. As you mentioned, he's working from Rideau Cottage, so it's not like, it's like some sort of nondescript army barracks, but this is something that's unusual, and I think we can expect to see the Prime Minister come out and speak to Canadians in a way to try and reassure them, reassure the nervous investors, reassure people who are concerned about
under quarantine, self-isolation as a result of his wife's positive test for COVID-19. Yesterday, it was UK Prime Minister Boris Johnson who addressed that nation. Paul Workman joins us now. And Paul, it was a pretty ominous message from Boris Johnson, but the overriding message still was we need to stick together here as a world during this very uncertain time.
That's very true. That was part of Johnson's message. But at the same time, the United Kingdom has struck out on its own with its own and very different strategy than the rest of Europe. Schools here, Lisa, have not been closed. Major sporting events have not been canceled. The government here seems to have a sense that at least some exposure to coronavirus is a good thing, and that it will build up a certain herd immunity in the country itself, even though the government now says 10,000 people may have the disease here, Lisa.
I have a doctor sitting right beside me, an infectious disease doctor, who's shaking his head at the notion of that. So jump in here, Dr. Charkawi, that idea that a little bit of this is not a bad thing. It seems like a strange theory.
Well, certainly from the point of view of suggesting that, you can acquire some degree of herd immunity, we're not talking about cookies that fall on the floor here that a child on a playground is picking up. We're talking about something that has shown a tremendous amount of transmissibility and is claiming a lot of lives. I think
so we've closed schools in this country, universities. I think we're up to 10 now across the country. Give me some real tips on, like, for example, if you're on the subway, what's the best thing to do for a person who relies on public transit?
If you rely on public transit, obviously you can't limit the number of people who are using public transit, but whenever possible, try and distance yourself from another person. We've used the definition of ideally about 6 feet away from someone, and that's because droplets will spread through that sort of distance and proximity from another person who may be infected. Obviously, if you see somebody who is coughing or sneezing or otherwise appears quite unwell with a fever, you should try and avoid them altogether. We recognize that people will continue to need to use public transit, and some people can unavoidably not work from home. We have to employ vigilant hand hygiene and the same measures we've been preaching all along to try and prevent viral transmission.
I think it's the idea of change that is really frightening for a lot of people, and the idea of all of a sudden you're at work and your boss tells you go home for the next 3 weeks. This throws people off. So the message again to them on how to manage this psychologically, I think there's a shift here also.
Most certainly, and I think that it speaks to the idea that we need to maybe reframe what we think of as a healthy work environment. We live in a culture and a society where people are potentially admonished for not showing up for work even when they may be symptomatic with the flu or some other viral illness. And if anything good can come of this by maybe saying that's not a good idea, you're doing yourself harm, you're doing others harm, you're maybe reducing your work productivity. We need to look at things from that point of view, maybe, instead of being too harsh on people.
And you know, the Prime Minister, I'm going to go back to Ottawa now, the Prime Minister was actually given a lot of credit for taking a proactive move, even the notion that he may be have contracted this because of his wife not feeling well by staying home. That does send the message that a lot of this may be the honor system. People who don't feel well, who have a fever, need to come clean on it, and to protect their colleagues, to protect the community. And Joyce, what were some of the backroom discussions, if you're aware, in that decision that really caused a bit of a gasp yesterday when we learned that our own Prime Minister was self-isolating?
Well, you know, they had to, in the Prime Minister's office, you imagine they were huddled together until late last night in the Prime Minister's office, trying to figure out exactly what to do. So the Prime Minister is actually in literal isolation. All his aides, even his closest aides, are not there with him. So he's on the phone with everybody. We know that he spoke to the Italian Prime Minister, the American President, and others yesterday. He keeps doing his work. He is actually, we were told, is feeling quite well, but he has nobody around him. The family is still at the cottage, though, and it's business as usual.
Okay. So the Prime Minister's wife is not in Rideau Cottage right now?
I believe that yesterday when I was talking to them, she still was at Rideau Cottage. The kids were still there. They're all asymptomatic except for Sophie Trudeau-Grégoire. Now we have to see if the Prime Minister starts, you know, not feeling well, then, you know, that those things may change.
And we can take a quick look at Sophie Grégoire Trudeau's statement that she put out late last night about the mild symptoms that she had been feeling. She says she'll be back on her feet soon. Being in quarantine at home is nothing compared to other Canadian families who might be going through this, and for those facing more serious health concerns. Now, in an effort to slow this down, the government is taking more extreme measures today. The Transport Minister, Marc Garneau, has just announced that they will soon be restricting all international flights to a smaller number of airports. He says, we believe this is a precaution we should take. We will have more details shortly. Kevin Gallagher, you're there. You've been watching this unfold over the last few days as sort of the government and provincial governments are each unilaterally on some levels making those decisions, and companies who should work from home, what schools are going to close, what measures governments are going to take to protect the community.
And you know, Lisa, think about the last 48 hours. In the last 48 hours, there have been all of these sorts of measures. In the last 24, we've learned that the Prime Minister's had to self-isolate because his wife has symptoms, and now a confirmed case, of course, of COVID-19. So a lot of this stuff is moving fast. Even just today in the House of Commons, of course, absolutely surreal to think that only 2 days ago they were announcing the date for the budget, and now just today, well, that game plan has needed to change, of course, because of this outbreak and because of the concern, of course, that it could get worse if it is business as usual. Clearly that is a big part of the message here. It's not. There are going to be changes, drastic changes for many people in their daily lives, and sometimes simple changes, of course, like we keep mentioning. Washing your hands, avoiding contact, you know, the elbow touch instead of the handshake. One of the comments from one of the parliamentarians, of course, leaving the House today was that, you know, just the notion that usually when they go on break week, which is supposed to happen today, parliamentarians go back to their ridings and they shake thousands of hands. Well, certainly that's something that they can't encourage now, and they wouldn't want other Canadians to think that they should do either.
And I see Terry Gilliam checking the microphone there in Ottawa, so it looks like we may be seeing the Prime Minister soon. But before that, I want to go to Montreal. Geneviève Beauchemin, our Quebec bureau chief. And Geneviève, that was such an interesting press conference yesterday yesterday from the Minister of Health there, basically saying we're not in a crisis because we are doing these things. And it's such an important and critical message to convey to people so they don't panic. This is all happening so the spread slows down.
Oh, absolutely. But they are closing all the schools here in the province. Yesterday, this is something that they said they didn't have to do, though a lot of schools went ahead and shut their doors for today, saying that they didn't know how long the schools would be closed. And at the time, the education minister yesterday said, no, it wasn't necessary to close all the schools. Now, a day later, the premier did come out and say that, yes, it's not time to panic. We're doing all this. We want to make sure that things are under control. But because we want to do that, and we know that this will cause a lot of inconvenience to so many people, but we have to shut down the schools for 2 weeks. And so all daycares, all grade schools, all high schools, all universities in the province are closed now for at least the next 2 weeks. And that's the key word, of course, at least the next 2 weeks. And the premier was saying that he understands that, you know, so many people are going to have to pitch in. Grandparents, people in the entourage of these families are going to have to pitch in. And there are going to be people who are not going to be able to go to work. And he understands, he says, just how much trouble, how much chaos this will inject into the lives of so many Quebecers. But he says at this point, we have to do this. This is part of the plan that will make sure that this province here doesn't see more cases. There are 17 confirmed cases at the moment. And he says that in order to keep that to a minimum, in order to flatten that curve we've been talking about, not have so many people at once in the health system, this has to be done.
And so there's so many layers to this. Genevieve, thanks so much for that. And Doctor, I want to bring you in again because, okay, so that's the society, civil society layer. On the science layer, there's also some news today that Canadian scientists have actually isolated, maybe you can explain it better than I can, the breakthrough that they've made on trying to get closer to some kind of vaccine.
Yeah, so the researchers at Sunnybrook Hospital here in Toronto have been working very diligently at this, and it's a tremendous accomplishment that they've actually been able to grow the virus itself. And once you're able to do that, it certainly is a major step towards being able to develop a vaccine that is going to be potentially useful against this.
What kind of a window does that? Like, this is still, are we looking at a year still away from a vaccine?
Certainly. We want to temper people's sense of excitement and enthusiasm that this is going to be a solution to this crisis and this problem. But it is certainly a step in the right direction. It takes an average of at least 6 to 9 months to have a vaccine trialed, tested even through animal models and other phases of testing before it can be rolled out and used on any mass scale within general populations.
And also, there's been some question about whether this, like the flu, although we're being told it's from 4 to 10 times more serious than the flu as far as the mortality rate goes, is it seasonal, or don't we know?
We don't know that, and that's a very interesting question, and one that actually might be answered potentially in the coming months when much of the Northern Hemisphere goes through summer. And one intriguing concept or question has been raised, which is why have Singapore and Thailand not necessarily seen the same spike of cases that we're seeing in neighboring countries? One thought might be it's the humid and very high temperatures that are there compared to neighboring countries. That's an interesting hypothesis.
They were also very proactive,
Absolutely.
both of those countries, in closing down their borders.
Absolutely. I certainly don't want to dismiss those efforts as being a part of that equation. But there is some thought or hope that with the summer months approaching, that this could burn out a little bit, so to speak. We still need to remain vigilant because as the Northern Hemisphere enters the summer, obviously the Southern Hemisphere will enter winter as well. So we can't become complacent. We certainly can't wait for that as a reason to expect that this will just go away on its own.
And the other question is, it's so great to have you here because I can ask all these questions that everyone's so curious about, and you're report out of China that indicated that mild included pneumonia, which surprised me. But give me your perspective on what does mild mean?
Yeah, so we need to take a step back and recognize that the term pneumonia has a wide spectrum of presentations. It may be mild enough that people are working and going about their everyday lives, but feeling a bit unwell. They may have mild respiratory symptoms. There may or may not be any findings on a chest x-ray. And at the other extreme, you might find people that are in dire distress with extreme shortness of breath who need to be admitted to hospital and end up in the ICU on a ventilator. We're not talking about those cases when we talk about the 80%. We're talking about those that were mildly symptomatic, that probably didn't require hospitalization, or if they did, recovered fairly uneventfully with a short course of treatment.
Are you canceling elective surgeries at your hospital right now in preparation for what may be to come, or what are some of the real changes in hospitals?
Yeah, that's an excellent question, and I think operationally it's become necessary to streamline what's being done. My understanding is that non-urgent cases have certainly been deferred and elective surgeries are being canceled. I'm not a surgeon myself, so I don't want to be quoted exactly on how much of that is going on. We know that we've been asked across the hospital to reduce our clinic load so that we minimize the traffic that go through our clinics. So we're trying to take tangible steps to limit the traffic through our hospitals.
And certainly, as we've been saying, one of the tangible steps our government is taking, the House will not sit now until April 20th, I think. We're going to go back to Joyce, but I first want to say what we have heard from the Prime Minister today came in the form of a tweet. Busy day ahead, he says, working from home, meetings with my cabinet, the country's premiers, national Indigenous leaders, and more, staying focused on you. Talk soon. And there he is, that's the picture actually from his home office at Rideau Cottage. Joyce, you are there in Ottawa. Your perspective on how a country gets governed from behind closed doors like this, it's no easy task.
Well, you know, I asked that question to Chrystia Freeland. She was in our studios yesterday, and I said, so if the Prime Minister has to self-isolate, are you the boss? Are you running the country, or is it him? And she said, no, I'll keep doing my job. And, you know, she will be sort of the outside Deputy Prime Minister, but he will be running the country from that office that you just saw on that picture. He's on the phone. His aides will not be there with him physically, but they're on the phone and they're talking all the time, I'm told. And, you know, it's sort of, in a weird way, Lisa, business as usual in an unusual circumstance, because he continues, you know, to work in his office. It's the home office instead of the office that's not far from Parliament Hill.
And certainly, I think one of the benefits is the fact that we live in such a digital era now. You know, companies around the globe for actually many years now have been doing teleconferencing. They've been doing Skype interviews, Skype meetings, this sort of thing. So certainly, I'm sure the Prime Minister has all the technology there behind that door at Rideau Cottage. He's going to be walking out that door, we're told, in just about 30 seconds from now, and we will hear from him directly. And but Joyce, I guess that's just the way of the future, not just for the Prime Minister and the way he's going to do, but we're going to take a quick break before we bring viewers in on our main network.
A CTV News special report.
Hello and thank you for joining us. We are interrupting regular programming this afternoon to update you on the COVID-19 pandemic, a health emergency in this country and right around the world. At any moment, the Prime Minister will emerge from where he lives here at Rideau Cottage to address the nation. This will be the first time we'll see Justin Trudeau since that announcement yesterday that he and his wife, Sophie Gregoire Trudeau, are in a 14-day quarantine. Of course, late last night it was revealed that she tested positive for COVID-19, and here is Prime Minister Justin Trudeau.
Good morning, everyone. Bonjour tout le monde. Yesterday, I shared with you that my wife Sophie was being tested for COVID-19, and that test did come back positive. Sophie's symptoms remain mild, but we are following medical advice and taking every precaution. She will remain in isolation for the time being. We are thinking about all the families across the country who've received the same diagnosis. But we're in good hands. We have full confidence in Canada's health officials and professionals. This means that Upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms, and I'm feeling good. And technology allows me to work from home. Of course, it's an inconvenience and somewhat frustrating. We are all social beings, after all. But we have to do this because we have to protect our neighbors and our friends, especially our more vulnerable seniors and people with pre-existing conditions. We are following medical advice, as should all Canadians. And on that note, I want to thank all of Canada's health professionals and the Public Health Agency who are doing an incredible job supporting and looking after all of us.
Yesterday, I informed you that my wife Sophie was tested for COVID-19 and the test was positive. The symptoms stay in quarantine for a non-determined period. We're thinking of all the families across the country who had the same diagnostic. We are in good hands. We have plenty of confidence in professionals of health and authorities of public health. It means that following recommendation of my doctor, I will be isolating myself for 14 days. I want to be clear. I have no symptoms. I feel very good. I work from home for precaution measures. Technology permits us to work at distance. Of course, it's not the ideal. It's a bit frustrating. We are all people that are sociable. But that's what we must do, to protect our neighbors, our friends, and mainly the elderly and those that have conditions. We are following the advice of the medical staff, like all Canadians should do right now. I'd like to thank all the professionals of the healthcare department and the public health agency that have been really exemplary to support us. I want now to let you know what Canada is doing to ensure your security and protect your health. Yesterday, I spoke with many international leaders, amongst them Donald Trump from the United States, President Johnson of Great Britain, and President of Italy. I also worked on a special committee, and I had a phone conference with the finance minister to what we can do right now. I also had a chance to discuss with the President and CEO of the Commerce Board of Canada. This morning, I participated in a meeting of cabinet, and I spoke to President Macron from France. And the discussions will go on. Earlier today, the ministers announced that the Canadians recommend to all Canadians to avoid non-essential travels outside the country. We also announced that the cruises season has been suspended and that we will have some tighter measure in security in the airport. We also are stopping some of the overseas arrivals.
Ministers Blair, Haidu and Garneau announced that Canada has advised Canadians to curtail non-essential international travel and that the cruise season is suspended until July, and that we are bringing in additional screening measures at airports. We are also streamlining overseas arrivals to be better positioned for screening. Yesterday, we saw many provinces take strong steps to keep people safe. They are doing what needs to be done to protect the public, and I want to thank them for their exemplary work. Later today, I will have a call with the premiers and Indigenous leaders to discuss the latest developments and coordinate our efforts, including the over $1 billion COVID-19 response fund, which provides money to the provinces and territories to support preparation and mitigation. These are significant steps, and we will do more. The provinces and territories are facing various levels of risk, but we will make sure that we align our response across the country. Addressing COVID-19 must be a Team Canada effort. To keep Canadians safe, To mitigate the economic impacts of the virus, all levels of government are working together. We are talking regularly. We are coordinating our efforts. We're following the situation very closely, and we're pulling out all the stops. I know that you're worried. You're worried about your health, about your family's health, about your job, your savings, about paying rent, about the kids not being in school. I know that you're concerned about uncertainty in the global economy. The steps being taken to keep you safe have an economic impact. But what is also true is that we are in the enviable position of having significant fiscal firepower available to support you. This is in addition to the measures we've already taken. The finance minister is also in constant communication with his international counterparts to find ways to work together to mitigate the impacts of the virus on the global economy. He will have further announcements shortly this afternoon. The agreement we reached with other parties to suspend the House today also still gives us the flexibility to do the things we need to do in order to support Canadians. No one should have to worry about paying rent, buying groceries, or additional childcare because of COVID-19. We will help Canadians financially. The Government of Canada will be introducing a significant fiscal stimulus package in the days ahead. Le gouvernement du Canada annoncera des mesures de relance fiscale
some fiscal measures important over the next few days. I know that you are numerous to be worried. Worried for your health and the health of your family. We're doing everything we must do to protect our economy. We are in a fiscal situation that is enviable. Every order of government is working together. Companies and citizens, we're taking precautions. We have now in Canada some health care professionals that are incredible, and they are doing incredible work.
Every order of government is working to stop the spread of the virus. Businesses and citizens are taking precautions. We have outstanding public health authorities who are doing an outstanding job. We will get through this together. Merci tout le monde.
Thank you, everyone.
Bonjour, Monsieur Trudeau. Louis Blouin.
Prime Minister Justin Trudeau, I think he may be taking some questions.
Voyageurs étrangers qui arrivent au Canada. Est-ce que vous pouvez être plus
foreign travelers in Canada? Can you be precise about what you're going to do for screening? Will be a number of flights that will be limited? Will countries be targeted? We are now working on precise measures, but I can tell you that will reduce the number of foreign travelers from overseas to proceed to a better evaluation so that we make sure of the safety of all Canadians. And also, we will also look into the origins of the flights, and we will continue to work every day to make sure that Canadians are safe.
We are looking to reduce the number of airports that will accept travelers from overseas in order to be able to give the proper resources on all arrivals to ensure that we're doing everything we can to keep Canadians and Canada safe. We're also obviously looking at countries of origin and further measures that we can take. We will make those decisions based on the best science, the best recommendations of our health officials.
Est-ce que ça fait partie de vos options de fermer complètement les frontières à certains pays?
Completely the frontiers for certain countries, and if yes, what are the criteria that will be followed? Our criteria to evaluate for the next decisions are entirely based on the recommendations of experts and the public health experts. We trust the experts here in Canada and across the world, and we're going to follow their recommendations. We are not shutting the door to the next steps. We're looking into everything we can do to continue to do the work that we're doing for the last few weeks to keep Canadians safe. and it will continue.
We will continue to make decisions based on recommendations of medical experts, public health authorities, and top scientists. We understand that we have taken significant measures over the past weeks and month to ensure that Canadians are kept safe and to slow the spread of the virus. We will continue to make determinations about how best to do that based on recommendations of experts. We're not closing the door to any further steps, but we will make those decisions based on what science tells us.
Ryan Tumulty, National Post, sir. The financial markets have had two of their worst days on record this week. I'm just wondering, you talk about the government's fiscal power. Why haven't we used it yet, and what are you planning to do?
2 days ago, we announced a $1 billion plan to help invest in health and support Canadians across the country. We've also put forward measures that will strengthen EI and help Canadians. We recognize there is much more to do. We do not want any Canadian to have to worry about whether or not they're going to be able to pay their rent, whether or not they're going to be able to buy groceries or care for their kids, or elderly family members. We need to make sure that Canadians have the options and the ability to follow the best public health advice and keep themselves safe. That is what we are focused on, and we will be rolling out those measures in the coming days. The Finance Minister will make further announcements later today on concrete measures to support our economy. But further to that, in my conversations with my fellow G7 leaders, we have agreed that it will be important for us to coordinate at a G7 level to impact the global economy, and we will be continuing to follow up on those conversations in the coming days as well.
Are you considering direct financial payments to Canadians or to affected industries?
We are looking at ways to help Canadians directly, yes. Particularly vulnerable Canadians who are going to be particularly squeezed if they aren't able to go to work. These are the kinds of things we're focused on. We also know that small businesses may struggle through or will struggle through this period of economic slowdown, of people choosing to stay at home and protect their families. We will look at how to support them so that once we get through this difficult time, our economy and Canadians will continue to prosper. We
are looking into how to help directly Canadians that could be in more difficult situation without a paycheck, and in the consequences, the extreme consequences on their lives, to take care of their kids or of the elderlies, or put some food on the table. We will take the direct measures to help Canadians that are facing difficulties, and at this point, and we'll also look into helping small enterprises, small businesses that will be facing some difficult weeks while responding to this threat of public health. We'll announce some measures this afternoon. The Minister of Finances will announce the measure, but also at the start of next week with other measures to help Canadians.
Prime Minister Catherine Cullen, CBC News. Obviously, we wish good health to all Canadians. But if you are to fall ill, members of your cabinet, for instance, what is the plan for governing?
We have continued to engage. I've been very busy both yesterday and today. We'll continue to work from home remotely to do the important things that need to be done to keep Canadians safe. We have an exceptional cabinet that is working hard on all these issues as well. We have extraordinary public servants who are working as well. We will continue to do the work that needs to be done to keep Canadians safe while following all directions by our public health officials.
I don't think that indicates whether there's a contingency plan in place if you were to fall sick. I'm also curious why public health officials have told you you don't need to be tested.
First of all, there have always been contingency plans for ministers who are sick or have, or even a prime minister who is fallen ill. We will continue to follow all those correct contingency plans. But as I said, for now, I am continuing to work extremely hard from home. In terms of advice I've gotten from medical professionals, it was explained to me that as long as I do not show any symptoms at all, there is no value in having me tested. Je suis les indications
I'm following
des experts en
the
santé
indications of health public experts that are saying that as long as I don't have symptoms of the COVID-19 or coronavirus, it's not necessary for me to be tested. But actually, Canadians right now probably asking themselves, if you add the COVID-19 but without the symptoms, you're sharing the same house to Madame Grégoire Trudeau. Why wouldn't you be tested systematically? The advice of the experts and doctors say that if I don't feel any symptoms, it would be useless. Madame Grégoire Trudeau, from what we understood last weekend, you met a lot of people over the week, especially in Toronto Monday and in Ottawa. Don't you fear to have been a vector of transmission? We spoke actually with the experts in health, on public health, and the fact that I have no symptoms. I have no symptoms of COVID-19, and means that, according to them, and according to what we understand, there's no risk for people that I worked with over the last week.
According to health officials, the fact that I have expressed absolutely no symptoms means that anyone I engaged with throughout this week has not been put at risk.
Marika Walsh with the Globe and Mail. I'm wondering, given the warnings that Canada is now giving about traveling abroad, should Canadians still be traveling between provinces, between cities, given how different the virus is spreading within Canada?
I think people need to make responsible decisions and check with their medical professionals and check their own travel plans in terms of what makes sense for them. I know that Canadians will listen to the advice of experts and make decisions that are appropriate for them and for their family.
And can you describe specifically what your self-isolation means, both for you and your family and your wife? You're outside right now. Is your wife still going outside? Is your family still going outside? What does self-isolation actually mean for your family?
We, as are many Canadians right now, following very carefully the advice that public health professionals are telling us in terms of what we can do and what we shouldn't do.
So what does that mean?
That means I am in isolation, as are my children, and my wife is in quarantine.
Glenn McGregor, CTV News. Prime Minister, in your conversation with President Trump yesterday, was there any discussion about future access of Canadians to cross the U.S. border and should the situation worsen? And also, do you have any concerns, given the U.S. slow response to this, about Americans coming here?
We have been working very closely with our counterparts in the United States to coordinate our efforts at the border and to align our efforts. There is certainly ongoing conversations that will continue to be had as the situation evolves, but I am confident we will continue to be able to work very closely with the Americans to keep people in North America safe, particularly to keep Canadians safe. On that, it is worth noting that it was one piece of good news that comes out of this situation is that the new NAFTA has now been fully passed and ratified and is now awaiting royal assent, which should happen very quickly.
Just following on my colleague's question, could you describe your situation domestically here in a little more detail? Is your wife here in this house? Are all three kids here? And if so, question a lot of Canadians are dealing with is how are you going to keep them occupied for the next 2 weeks?
Most of the morning, the kids have been doing Lego, and my wife has been on the phone to friends and family. I have been on the phone with President Macron, with cabinet, with officials and members of my team as we work to keep Canadians safe.
Good afternoon, Prime Minister. Teresa Wright from the Canadian Press. What is your single biggest concern about Canada's preparedness at this point?
My concern is that Canadians continue to follow the directions of public health authorities. We have to be alert and responsible. We don't want to panic, but we don't want to take this too lightly either. Finding that middle ground is always going to be challenging, but I have tremendous confidence that Canadians are going to be able to.
And what are you telling your children about the heightened sense of concern in the country, and also how are you explaining some of the political decisions that you're making?
We're obviously having some very good conversations with our kids about what's going on, about how not to be overly concerned, but to be a little bit concerned, which is obviously why they are home today with us. We're going to continue to have thoughtful conversations as parents across the country will be having with their kids.
Last question.
Prime Minister, good afternoon. Bruce Campion-Smith, The Star. Just wondering if you'd walk us through the logic that Canada has not taken the step of restricting international travels. Is that we don't agree with perhaps the science in those countries or the experts in those countries that advocate for such a move?
Different countries will have experts that give them advice that is suitable for their own situation. We have followed the instructions and the advice and the recommendations of our top public health officials. We will recall that in a number of weeks ago, in the beginnings, there was discussion of whether or not we should entirely close our borders to China the way the United States did. We did not, and we were able to manage it in a way that allowed for control and a non-spread of the virus that gives us confidence that our public health officials are giving us the right recommendations for Canada.
And on the fiscal stimulus package that's coming out, can you just describe to how will is that in place of the budget? Is this kind of a series what we could expect now through the end of this crisis?
We are obviously focused primarily on how we are going to get money into the pockets of Canadians who will need it because of this situation. We've had many discussions over the past months about the budget. That work will continue, but our focus right now is on ensuring that Canadians have the resources and the money to not have to stress about rent and about groceries and about childcare and elder care at a time where they're also very worried about their health and their family's health. We will be supporting the economy and Canadians through this time.
Our priority now is for the health and the wellness of Canadians. We want that no Canadians that have preoccupations about paying rent or to feed their kids or help their elderly. We're going to do everything is necessary to help them in these difficult moments. Obviously, the reflection that we've had for the last 2 weeks on the budget are going forward and how to help Canadians in these tough moments. Thank you, everyone. Thank you, everyone.
So there was a great deal in the address by the Prime Minister there, the first time we're seeing him since he has self-isolated. Joyce Napier is in the Ottawa Bureau. Joyce, I know you're probably already working the phones to find out just how this fiscal stimulus package is actually going to roll out. But what a mammoth operation for any government to basically give Canadians the confidence that their rent will not be compromised, that their wages for those who